and welcome to today's session on Systematic Reviews 101. Your presenters today are Naomi Lee, who is Executive Editor Digital for The Lancet, and Paul Whaley, who is Associate Editor of Systematic Reviews for Environment International. Today's session will last approximately 1 hour, and you can ask your questions throughout the course of the session using the BrightTalk interface. We'll be asking a selection of your questions to the speakers at the end of the session. If you're watching this webinar on demand, you can visit the Researcher Academy Mendeley group to pose any remaining questions to other researchers just like you. The link to the Mendeley group can be found under Resources on the bottom right-hand corner of your page. We definitely recommend you to join the group even if you're watching the event live. One more housekeeping announcement before we move on to the webinar. The slides of this presentation and any other documents relevant to this webinar, including the 5 mistakes you're making trying to get your systematic review published, can be found under Downloads, also on the right-hand corner of your Researcher Academy screen. Thank you so much for joining us today. I'll be back at the end of the session to ask your questions, so make sure to keep them coming. Now over to you, Naomi.
Hello. Laura, thanks very much for a fantastic introduction and for the invitation to be here presenting on this topic today. Just to tell you a little bit about myself, that I'm a doctor and I worked in the UK National Health Service until about 4 years ago, specialising in surgery. I joined the Lancet 4 years ago, where I handle peer review and commissioning, and my special interests are in medical technology, health informatics and surgery, my background. When we think about systematic reviews, we see them as a way to answer a predefined research question by collecting and summarising all of the evidence that fits into a pre-specified eligibility criteria. And the outcome of this can be qualitative or quantitative. And the two factors that make a systematic review are that the criteria are predefined and that there are eligibility criteria. So it's a very structured way of assessing what evidence is there and giving a summary of that evidence. When you consider a systematic review, many are done in combination with a meta-analysis, which uses statistical methods to summarize the results of the included studies. So that's always quantitative. What's the point of systematic reviews? Essentially, and most importantly in health research, it's to assess unanswered questions without necessarily having to perform a new trial. So really the idea is to sum all of the knowledge available to give either a more conclusive answer without having to repeat the research or carry out a bigger trial, or to give a conclusive answer to something which remains inconclusive. So it's a very efficient and ethical use of resources, financial resources, and patient time, energy, patients enrolling into trials, and so particularly important in health research. And also very important for evidence-based medicine, because it's a way that you can refine very large amounts of information, which can be heterogeneous or sometimes homogeneous, in order to give an answer that a clinician can use to influence clinical practice. What makes a good systematic review? The most important thing is that it addresses a useful research question. So it adds useful information, and that can be either answering a question, as we were just mentioning, or setting out an area in which you're assessing the information available and coming to the conclusion that it's lacking. Prospectively registering the systematic review, for example with Prospero, is obviously good practice, but it's also a sign of a quality systematic review carried out by a good group. We would also expect a clear search strategy. So that means what's the criteria for inclusion, how were the data sources assessed, what level of data was sought, who did this, and how were conflicts resolved. The quality of evidence is very important, and with this statement that depends to some extent on the aim or the area of the systematic review. So the quality of the evidence determines the confidence in the answer generated, and that's where you'll often hear people using a slightly crass phrase, which is the garbage in, garbage out, meaning that if the quality of the included studies is low, then the confidence that one should have in the answer, the kind of summary statistic produced by the systematic review, should also be low. So sometimes this can be important when you're setting out a summary of the evidence and illustrating gaps. That's important. but often more high impact factor journals will look for more. So looking for systematic reviews that are presenting information based on studies which have better data that answers a clinically relevant question, and often looking for a kind of practice-changing answer. We would always expect that a systematic review would follow reporting guidelines, of which more to come. And one of the key things in writing up a systematic review is to put the research into context. So the systematic review is not just a technical exercise, but it's based very much in clinical practice, in a real clinically relevant question. So it's important to bring out that question when writing up or thinking about the systematic review. So why is this important? What does the systematic review add? You know, where are we moving on from here? Is it that more research is needed, or is it that clinical practice should be changed? Thinking specifically about the reporting standards, the Equator Network is an umbrella organisation which aims to improve the quality and transparency in health research, and they produce many reporting standards, of which PRISMA, the preferred reporting items for the systematic reviews and meta-analysis, is one. And the aim here is to improve the transparent reporting for systematic reviews and meta-analysis, but it's often useful not just in the write-up of a systematic review, but also a tool that can be used in planning and to some extent in quality assessment, because it has a checklist which explains how to write a structured summary, how to write an introduction which discusses the participants, the interventions, the comparisons, outcomes and the study design, how to describe the methods. So we discussed earlier on the search strategy and data collection, how one should describe the assessment of the risk of bias and the summary measures produced, and then also the results, how studies were selected, how to report their characteristics, what the results of the individual studies were, and how the results were synthesized. Another key player in thinking about specifically health meta-analyses or systematic reviews is the Cochrane Review. So it's a network of international collaborators, and the aim is to gather and summarize the best health evidence to make informed decisions. And so this group's very key to evidence-based medicine, the movement of evidence-based medicine, by both publishing systematic reviews and providing support to authors in how to produce a good quality systematic review, how to report them. And they produce a very useful document, which is the Handbook for Systematic Reviews of Interventions. I wanted to give just a mention of meta-analyses, which of course could be a presentation in their own right. But this is a way to combine the results of the included studies to give an overall summary statistic. And it's an estimate of the outcome of the intervention based on all of the available evidence. And the results are often summarized in what's called a forest plot, which gives this overall summary statistic. So you can have some idea of, just from looking at the forest plot, about the number of studies that are included, the size of those studies, the confidence interval of those studies, the outcome of each of the studies, and then the overall result on the forest plot gives you an idea of the additional information which the meta-analysis has added to this question. So they're often used to give a very quick assessment of the studies included in the systematic review, the quality of those studies, and then whether or not the meta-analysis or the systematic review has provided an important addition. So you can see in this example here, the included studies don't give a clear answer towards the intervention or the placebo, but when you look at the results of the meta-analysis, then it has given additional information.